Hello students, today we continue the topic human health and diseases. From this topic we start a new point, that is the different types of diseases. These are, first one we are going to study, that is typhoid. Typhoid is an acute infection of intestine. It is caused by Salmonella typhi. Bacteria of typhoid is gram-negative bacteria. It is found in the intestinal lumen of infected person. Pathogenicity is due to O antigen. See in the diagram, the body covering shows the O antigen. It is a lipopolysaccharide, commonly known as LPS, and the flagella contains H antigen. See in the diagram the structure of Salmonella typhi, which having the oval structure and O antigen and H antigen which are present on the body. Then symptoms of the typhoid. It shows fever as high as 104 degree Fahrenheit, general nausea, fatigue and headache. It also shows symptoms such as abdominal pains, constipation or diarrhea, rose-colored rash on skin, white coat on tongue and cough, loss of appetite, commonly anorexia, and if not treated, that means if any treatment is not given to the patient, breathlessness, irregular heartbeats and hemorrhage also observed. Then the modes of transmission of this disease. Generally, it is a food and water-borne disease. Insects like housefly and cockroaches transfer the bacteria to the food material. Poor hygienic habits and poor sanitation also spread the typhoid. Then see the diagnosis and treatment. For the diagnosis, a specific test is used that is known as Widal test. And in the treatment, in severe cases, the gall bladder is removed. And antibiotics like chloromycetin is helpful for the treatment. But for prevention of typhoid, WHO recommends two vaccines. One is oral, that is Ty21A vaccine, and other one is the injectable typhoid polysaccharide vaccine, and both these are sold as the name typhim 6 and typherix. तर अशा पद्धतीनं टायफॉईडवरती ट्रीटमेंट, अगोदर डायग्नोसिस करायचं आहे विडाल टेस्टच्या साहाय्याने आणि मग त्याला ट्रीटमेंट द्यायचे. देन नेक्स्ट डिसीज, दॅट इज न्यूमोनिया. Pneumonia is inflammatory condition of lungs and alveoli. It is caused by variety of pathogens that may be viruses like influenza virus, adenovirus, parainfluenzae, and respiratory syncytial virus, commonly known as RSV, or bacteria like Streptococcus pneumoniae, or fungal pathogens, for example, Pneumocystis cerevisiae आणि Pneumocystis carinii. तर अशा पद्धतीनं दोन फंगल पॅथोजेन्स पण न्यूमोनिया कॉज करू शकतात. न्यूमोनिया also caused by chemical burns or physical injury to lungs. Then we study the signs and symptoms. Generally, the symptoms such as cough produces yellow or greenish sputum, high fever, shortness of breath or dyspnea, chest pains during deep breathing or coughing, and loss of appetite, भूक मंदावते, fatigue, then headache, vomiting, joint pains, and muscle aches. These are the symptoms of pneumonia. Then we see the mode of transmission. Pneumonia spreads by direct person to person contact. It also spread via droplets released by infected person and by using shared clothes and utensils. म्हणजे इन्फेक्टेड पर्सनची काही साधनं जर हेल्दी पर्सननं वापरली तर न्यूमोनिया स्प्रेड होण्याची शक्यता असते. Then see the diagnosis and treatment of pneumonia. There is course of treatment depends upon pathogens leading to the disease. For bacterial pneumonia, antibiotics like benzyl penicillin, ampicillin, and chloramphenicol, these are most effective as a treatment. See the infectious agents of pneumonia. See in the diagram. There are different forms of viruses and bacteria such as adenovirus, then Legionella, Pneumophila, Streptococcus pneumoniae, etc. Aspergillus. See in the diagram. The prevention and control is by vaccination. That means the vaccination is important prevention in both children and adults. Vaccines against Haemophilus influenzae and Streptococcus pneumoniae in first year of life, which reduces the chances of causing pneumonia. या अशा पद्धतीनं व्हॅक्सिन पण अवेलेबल आहे जे पहिल्या वर्षात दिलं जातं ज्याच्यामुळं न्यूमोनिया चान्सेसचे रिड्यूस केले जातात. Then next disease known as common cold. It is a viral infectious disease of upper respiratory region. रेस्पिरेटरी सिस्टीममध्ये अप्पर आणि लोअर रिजन्स आपण सिस्टीमचे बघितलेले आहेत. त्यातल्या अप्पर रिजनमध्ये जनरली हे इन्फेक्शन होतं. इट इज ऑल्सो नोन ॲज नॅसोफॅरिंजायटिस or acute viral rhinopharyngitis or acute coryza or a cold. हे वेगवेगळी त्याची नावं आहेत. It is caused by a group of viruses known as rhinovirus and coronavirus. सध्या आपण रिसेंटली ह्या व्हायरसची फेस करतोय, पूर्ण जग फेस करतंय आणि असा ग्रुप आहे व्हायरसेसचा ज्याच्यामुळे कोरोना व्हायरस होतो. सी द साइन्स अँड सिम्पटम्स. कफ, सोअर थ्रोट, रनिंग नोज अँड फीवर. जी सध्या कोरोना व्हायरसची सगळी लक्षणं आहेत हीच कॉमन कोल्डची लक्षणं आहेत. नॅसल कंजेशन अँड स्नीझिंग. देन कंजक्टिव्हायटिस, दॅट इज द आईज बिकम्स रेड. मसल रॅशेस, फटीग, हेडेक, शिवरिंग अँड लॉस ऑफ ॲपेटाईट. एकमेकांशी रिलेटेड हे सगळे सिम्पटम्स आहेत. त्याच्यानंतर प्रिव्हेन्शन अँड कंट्रोल, दॅट इज इम्पॉर्टंट अँड इट मस्ट. Stay away from person suffering from common cold. Then washing hands with soap and water. Then that is important. See, use of handkerchief to cover the nose and mouth during coughing and sneezing. Actually इथे handkerchief सांगितलं, आता आपण मास्क वापरतोय. And using of alcohol-based hand sanitizer. So these are the preventive measures or controls of common cold. Then next disease is ringworm. It is commonly known as dermatophytosis. ज्याला आपण मराठीमध्ये नायटे, खरूज अशा शब्दांनी हे शब्द आपल्याला माहिती आहेत. Actually, it is caused by many fungal species such as Trichophyton and Microsporum. These fungi feed on keratin in skin, hair and nails. Then see the symptoms. Actually सिम्टम्स जे आहेत ते आपल्याला माहिती आहे. नायटे झाल्यानंतर कशा पद्धतीचं एक राऊंड रिंग फॉर्म होते. स्किन शोज एनलार्ज्ड रेड रिंग कॉज्ड ड्यू टू अ रिंग वर्म. ॲपिअरन्स ऑफ ड्राय स्केली लेजन्स. जखम होते, कोरडी जखम असते काही वेळेस ओली जखम असते इन द व्हेरियस पार्ट्स ऑफ द बॉडी. दीज रेड पॅचेस कॉजेस इंटेन्स इचिंग. खूप खाज सुटते म्हणजे सहन होत नाही. जर अशा पद्धतीचं इचिंग व्हायला लागलं की अनरेस्ट म्हणजे अनइझी होतं आपल्याला. इन्फेक्शन्स टू द नेल्स इज टर्म्ड ॲज onychomycosis, in which nails becomes discolored, thick and disfigured. It also shows athlete's foot. That is, the fungal infection usually begins between the toes. पायाच्या बोटांमध्ये अशा पद्धतीचं इन्फेक्शन होतं, फंगल इन्फेक्शन. दॅट इज कॉमनली नोन ॲज द ॲथलेट्स फूट. Then modes of transmission. Ringworm spreads by sharing of clothes. Comb of infected person म्हणजे एकमेकांचा कंगवा सुद्धा वापरायचा नाही. डोक्यामध्ये डॅन्ड्रफ असतो तो सुद्धा एक टाईपचा फंगल इन्फेक्शन आहे. Then it also spreads by close contact with infected person. Then diagnosis. Actually, this disease, fungal infection, is diagnosed by physical examination and it is treated with use of drugs such as nystatin, fluconazole and itraconazole. So these are the diagnosis and treatments. See in the diagram the red patches, that is the lesion म्हणजे जखम रिंगवर्ममुळे झालेली. एनलार्ज व्ह्यूमध्ये पण दाखवलेलं आहे. आणि जे रिंगवर्म आहेत त्याचे हायपी जे आहेत दॅट इंट्रोड्यूस into the skin and causes the lesions. Then how it is prevented or controlled? It is avoided by close contact. Avoid sharing of clothes and sport equipments and washing clothes in hot water with fungicidal soap which destroy the fungal pathogens. अशा पद्धतीनं याचं इन्फेक्शन प्रिव्हेंट केलं जातं किंवा कंट्रोल केलं जातं. नेक्स्ट वन डिसीज दॅट इज नोन ॲज डेंग्यू. Actually, dengue fever is a painful, debilitating vector-borne disease. Remember, it is a vector-borne disease and caused by the dengue viruses. And that dengue virus is transmitted through the bite of female Aedes mosquito. It is the species Aedes mosquito. The mosquito takes up the dengue virus when it sucks blood of infected person, and this disease cannot spread directly from one person to another person. That is important. Then next disease which is dangerous, that is the cancer. It is one of the main killer disease nowadays. Cancer is abnormal, uncontrolled and purposeless division of cells, and it may lead to the formation of mass of undifferentiated cells that is commonly known as tumor. When tumor is malignant, it is described as cancer. Malignant, that means it invades the other tissues or neighboring tissues. That is known as malignant, and it is uncontrolled. Then actually when tumor is malignant, it is described as cancer, and that cancer harms the body when cancerous cells divide uncontrollably to form new lumps or mass of tissues and called as neoplasm. एक विशिष्ट प्रकारचं असं मास तयार होतं सेल्सचं किंवा लंप तयार होतात. अँड इट हॅपन्स एक्सेप्ट ल्युकेमिया. ब्लड कॅन्सर सोडला तर बाकी कॅन्सरमध्ये अशा पद्धतीचं मास किंवा लंप्स फॉर्म होतात. Physicians and researchers who specializes in the study, diagnosis, treatment and prevention of cancer is called oncologist. Then types of tumors. As we know, there are two different types of tumors. One is the benign tumor, which is non-malignant, and another one is the malignant tumor, which is cancerous. म्हणजे जनरली आपण असं म्हणतो की ऑल ट्युमर्स आर नॉट कॅन्सरस. एखादी गाठ झाली की ती कॅन्सरचीच गाठ असते असं नाही. तर ते दोन प्रकारचे ट्युमर्स आहेत इथं. एक बिनाईन ट्युमर और इट इज कॉमनली नोन ॲज द नॉन मॅलिग्नंट, अँड अनदर वन इज द मॅलिग्नंट ट्युमर और इट इज कॅन्सरस ट्युमर. Benign tumor grows slowly and may attain large size, but it remains restricted to the site of its origin. कारण त्याच्यावरती एक कव्हरिंग असतं, शीथ असते, मेम्ब्रेन असतं. Some benign tumors are harmful and fatal. That means death occurs. For example, brain tumor. Benign tumors may sometime become malignant. For example, adenoma and fibroid. At दोन टाइप्समध्ये it invade in the neighboring tissues. Therefore, it becomes malignant. Then the next type, that is the malignant tumor, or simply it is known as cancer. The growth rate of this tumor is rapid and mortality rate is comparatively more than the benign tumor. म्हणजे मृत्यूचं प्रमाण जे आहे ते मॅलिग्नंट ट्युमरमध्ये बेनाईन ट्युमरशी कंपेअर केलं तर जास्त आहे. इट शोज रॅपिड ग्रोथ. Also, the rapid growth of tumors causes overcrowding and disruption of normal cells. And therefore the cancer cells compete with the normal cells for nutrients and finally kill them. अशा पद्धतीनं त्याचं इन्फेक्शन वाढत जातं. These cells are spread from one organ to other via blood or lymph and form new tumors called secondary tumors. And this migratory process is called metastasis. म्हणजे मॅलिग्नंट ट्युमर नेबरिंग टिश्यूमध्ये इन्वेड होतो आणि म्हणून मॅलिग्नंट ट्युमर जो आहे तो डेंजरस आहे बेनाईन ट्युमरपेक्षा. कारण बेनाईन ट्युमरवरती कव्हरिंग किंवा शीत असतं, त्याची ग्रोथ आहे तेवढ्यापुरती लिमिटेड असते. डायग्रॅममध्ये बघा मॅलिग्नंट ट्युमर आणि बेनाईन ट्युमर दोन्हीचंही स्ट्रक्चर किंवा सेल्स दाखवलेले आहेत. त्या पद्धतीनं आपण बघू शकतोय. देन वी स्टडी टाइप्स ऑफ कॅन्सर्स. There are number of types, but we study the 5 main types. That is carcinoma, that arises from epithelial tissue covering or lining the body organs. It includes breast cancer, lung cancer, cancer of stomach and skin cancer. Then C, the second type, that is known as the sarcoma. It arises from the connective tissue. It includes bone tumors or osteosarcoma, muscle tumors or myosarcoma, cancer of cartilage, that is chondrosarcoma, and cancer of adipose tissue, that is liposarcoma. जे अशा पद्धतीचे नंबर ऑफ एक्झाम्पल्स त्याचे सांगता येतील कनेक्टिव्ह टिश्यूमध्ये झालेले. Then next type is lymphoma. It arises from the lymphatic tissue and it occurs in the lymphatic nodes, spleen and tissues of immune system. The next type, that is the leukemia. It arises from, or there is excessive formation of white blood cells or leukocytes. Commonly it is known as blood cancer. That increased number of or excessive formation of WBCs in the bone marrow, and people suffering from leukemia have very high leukocyte count. The blood contains millions of abnormal immature WBCs that are incapable of fighting infections. There are various types of leukemia such as monocytic leukemia, lymphoblastic leukemia, etc. Then next type is adenocarcinoma. It arises in thyroid, pituitary, adrenal and other glandular tissues. तर अशा पद्धतीनं कॅन्सरचे टाईप्स आहेत. त्याच्यानंतर आपल्याला बघायचं आहे कॉजेस ऑफ कॅन्सर. त्याच्या अगोदर टाईप्स बघा. हाऊ द कॅन्सर सेल्स इन्वेड इन द नेबरिंग टिश्यूज or the tumors form. For example, see in the diagrams, that is the cancerous kidney and healthy kidney, and how the disease spreads nearby tissues. अशा पद्धतीनं कॅन्सरची ग्रोथ होत असते. Then we study the causes of cancer. Actually, there are number of causes or cancer causing agents. These are known as the carcinogenics. These are chemicals, radiation, viruses, then oncogenes and addictions. First we study the chemicals. There are number of chemicals which includes nicotine, caffeine, products of combustion of coal and oil, then polycyclic hydrocarbons, some sex hormones and steroids. म्हणजे number of chemicals आहेत त्याच्यामुळे कॅन्सर होऊ शकतो. Breast cancer, which are observed in women, it is the hormonal relation and it is observed in women who avoid breastfeeding. त्याच्यानंतर next आहे radiation. There are number of rays which are exposed to the body such as X-rays, gamma rays, cosmic rays, ultraviolet rays. These are carcinogenic. And skin cancer is higher in the people working in sunny areas due to ultraviolet radiations. Then next type is viruses. Viruses causing cancer have genes called as viral oncogenes or p-oncogenes. These viruses are also called oncogenic viruses. For example, EBV, Epstein-Barr virus, or HPV, human papilloma virus. Next one is the oncogenes. Number of genes called cellular oncogenes or C oncogenes, or also called proto-oncogenes, have been identified in normal cells and they lead to oncogenic transformation of cells. And last one is the addiction. Different types of addictions like smoking, chewing of tobacco lead to the cancer of mouth, lips and lungs. Alcohol consumption may result in cancer of esophagus, stomach, intestine and liver. Some drugs also causes cancer. These drugs are marijuana and anaerobic steroids. अशा पद्धतीनं काही ॲडिक्शन्स असतात, व्यसनं असतात, त्यामुळं पण कॅन्सर होऊ शकतो. See in the table, there are number of different types of carcinogens, that means the cancer causing substances, and the organs affected. That organs affected mostly lungs and liver, major lungs, and other organs also skin, prostate gland, urinary bladders, vagina, etc. That is important. Then next, treatment of cancer. Generally, there is no single treatment done on the patient, but there is the combination of treatments at a time, that is known as the combination therapy. So these treatments are such as chemotherapy, radiotherapy, surgery, immunotherapy, and supportive therapy. Let us see one by one. First, chemotherapy. Administration of certain anti-cancer drugs includes chemotherapy. The anti-cancer drugs check cell division by inhibiting DNA synthesis to cancerous cell than to normal cells. Thus, chemotherapy may lead to hair loss or anemia, but both get corrected after the treatment is stopped. म्हणजे बऱ्याच वेळेस किमोथेरपीमध्ये केस गळतात, विकनेस येतो, तो परत रिकवर होतो. नेक्स्ट वन इज द रेडिओथेरपी. In radiotherapy, the basic principle is to bombard the cancerous tissue or cells with the radioactive material or with the rays of radioactive materials, and these are cobalt, iridium, and iodine. The X-rays, gamma rays, and charged particles are used to destroy the cancerous tissue, but it causes minimum damage to the surrounding normal tissue cells. म्हणजे रेडिओथेरपी करताना बऱ्याचशा नॉन कॅन्सरस सेलला सुद्धा डॅमेज होण्याची शक्यता असते. Then next treatment is surgery. Actually, entire cancerous tissue are removed surgically. In certain cases such as breast tumor or uterine tumor, the surgery is most effective, but other treatments are also given to kill any cancerous cell that may escaped in surgery. म्हणजे सर्जरी करताना जर काही टिश्यू कॅन्सरस तशाच राहिल्या असतील तर त्याच्या जोडीला अजून एखादी ट्रीटमेंट या पाचपैकी दिली जाऊ शकते. देन नेक्स्ट वन इज द इम्युनोथेरपी. ट्यूमर सेल्स have been shown to avoid detection and destruction by immune system. पटकन डिटेक्ट केले जात नाही ट्यूमर सेल्स इम्युनिटीकडनं किंवा इम्युनी सिस्टीमकडनं. Therefore, the patients are given substances called biological response modifiers, and these are alpha interferon, which activates their immune system and helps in destroying tumor. प्रतिकार क्षमता वाढवण्यासाठी अल्फा इंटरफेरॉन सारखे बायोलॉजिकल रिस्पॉन्स मॉडिफायर्स दिले जातात. And last one is the supportive therapy. Supportive therapy is used to treat symptoms of cancer and side effects of cancer treatments. Objectives of this therapy is to improve the quality of life of cancer patient, and this therapy varies depending upon the condition of इंडिव्हिज्युअल पेशंट, पर्सन टू पर्सन हे चेंज होऊ शकतं. अशा पद्धतीनं कॅन्सरवरती ट्रीटमेंटसुद्धा आहे. जनरली प्रायमरी स्टेजला कॅन्सर बरा होऊ शकतो. विल पॉवर पण स्ट्रॉंग पाहिजे, इम्युनिटी पण चांगली असणं गरजेचं आहे आणि कॅन्सर बरा होऊ शकतो, त्याच्यावरती ट्रीटमेंट आहे. अशा पद्धतीनं आपण डिसिजेस स्टडी केलेले आहेत. थँक्यू.